Hello, professional. This is Dr. Saad, and as you know, we are recording series of lecture for pharmacists who are going to appear for international equivalency exam. So, after antifungal drugs, we will talk about today miscellaneous antimicrobial agents, disinfectants, antiseptics, and stimulants. So, let's begin our topic. Point number one is about polymyxin B, that is the similar to the basitromycin, and the next point is about the polymyxin B is similar to the basitromycin. This is the point. Point number next is the nitrofurantoin. Nitrofurantoin is useful for gram-positive and gram-negative bacteria, and it is act as an urinary tract antiseptics, and it is more effective in acidic environment. The next point is about the polymyxin B, nystatin, and amphotericin B. Their mode of action is to interfere in cell membrane functioning. And as long as the metronidazole is concerned, and metronidazole is useful for anaerobic and mixture of intra-abdominal infection, and it is in combination with other agents active against anaerobics. It is often used with other agents who are active against anaerobics. It is also used for vaginitis, and microbe involved in that is the trichomonas infection and bacterial infection and Clostridium difficile colitis infection and brain abscess. These are the microbial coverage of metronidazole. Typical dosing is 500 mg 3 times per day, and through IV route its dose is 30 mg per kg per day, and vaginitis may respond to single 2 gram dose also. We also have this option. Vaginal gel is available for the topical use. As long as its ADR is concerned, it causes nausea, diarrhea, stomatitis, and peripheral nephropathy with prolonged use. And it also have a disulfiram-like effect, so patient should be ensured to avoid alcohol. Next drug is that comes under this class is the fidaxomicin. Its dose is 200 mg BD 2 times per day for 10 days, and it is approved by US FDA for the treatment of C. difficile colitis infection in adults. Next drug is rifaximin. Rifaximin. It is it is used for traveler diarrhea, hepatic encephalopathy, IBS associated with the diarrhea. Sorry, main point is that traveler diarrhea, hepatic encephalopathy, and IBS, especially associated with diarrhea. And its dose is 200 to 550 mg orally twice daily for 2 to 3 times per day. This is its dose. And next drug is mupirocin. Mupirocin is active against gram-positive cocci, and including methicillin susceptible, resistant. Topical treatment is this drug is managing minor skin infection and for example minor skin cuts and infection, and example is the impetigo. Polymyxin B and polymyxin BE is available in the form of ointment, and sometimes it is used in the mixture of neomycin. Next point is about the dose of urinary tract antiseptic, that is well known as nitrofurantoin. Its dose is 100 mg 100 mg orally 4 times daily. So this was all about this chapter important points. So let's discuss its summary and we will conclude it. As long as the anaerobic infection and vaginitis and Clostridium C. difficile colitis is concerned, it is treated by the use of metronidazole, and its side effect is toxicities, gastrointestinal upset, and neuropathy and seizures. As long as difficile colitis is concerned, other option is available in the form of fidaxomicin, and it has its toxicity is non-specific gastrointestinal upset. As long as the travel diarrhea, hepatic encephalopathy, C. difficile colitis, irritable bowel syndrome is concerned, the drug which is used for it is the rifaximin, and its toxicity is nausea. And as long as uncomplicated urinary tract infection and long-term prophylaxis is concerned, urinary tract antiseptic that is known as nitrofurantoin is considered, and its toxicity is gastrointestinal upset, nephritis, hypersensitivity, and pneumonia. So these are the points that was relevant to this chapter. So next point is about recommendation of non-surgical prophylaxis antimicrobial drugs. It's just a recommendation and a list of drugs which I will read. Just keep it for your information. Maybe make it as a part of prescription, but it's just for information. I'll mention some indication and drug of choice and their efficacy. So let's begin. As you know, when there is a case of anthrax, then its drug of choice is considered as a ciprofloxacin, doxycycline. it has a proposed efficacy. Similarly, if there is a case of cholera, then tetracycline is recommended, but it also have a proposed efficacy. Similarly, in case of diphtheria, there is penicillin and erythromycin is recommended, and endocarditis, amoxicillin and clindamycin is recommended. And in case of genital herpes simplex, acyclovir is recommended. It has an excellent efficacy. Similarly, peripheral herpes simplex, it also recommended. Acyclovir is also recommended for it. Similarly, when group B streptococcal infection cases, then amoxicillin and penicillin is excellent option. And in case of Haemophilus influenza type B, is for this case rifampine is has an excellent efficacy. Similarly, in case of HIV infection, tenofovir tenofovir is an option. It has a good option in response to efficacy for its management. Similarly, in case of influenza A and influenza B, oseltamivir is a good option, and in case of malaria, chloroquine is an excellent option. And in case of meningococcal infection, rifampicin, ciprofloxacin, and ceftriaxone is an excellent option. And in case of mycobacterial avium complex, zithromycin, clindamycin, and rifabutin is an excellent option. In case of otitis media, amoxicillin is a good option. And in case of pertussis, azithromycin is an excellent option. And in case of plague, tetracycline is a proposed effect. It has a proposed effect. In case of PCP, that is known as pneumocystic pneumonia, for that trimethoprim, sulfamethoxazole, dapsone, and atovaquone. These drugs has an excellent option. And in case of rheumatic fever, benzatine and penicillin. In case of rheumatic fever, benzathine and penicillin. It is an excellent option. In case of toxoplasmosis, trimethoprim sulfamethoxazole combination is a good option. And in case of tuberculosis, isoniazid or rifampicin, or in a combination of isoniazid and rifampicin, has an excellent efficacy. Similarly, in case of urinary tract infection prophylaxis, trimethoprim sulfamethoxazole is excellent option, especially in case of recurrent infection. So these are recommendations for non-surgical antimicrobial prophylaxis. And now we'll talk about recommendation for surgical antimicrobial prophylaxis. So in case of cardiac, cefazolin is an option. In case of non-cardiac, thoracic, cefazolin is again an option. In case of abdominal and lower vascular, including abdominal and lower extremities related infection of prophylaxis, cefazolin again is an option. In case of neurosurgery, cefazolin is an option. And in case of orthopedic, we have cefazolin, again it is an option. And in case of head and neck injury, cefazolin and metronidazole is an option. And in case of gastroduodenal cases, we have cefazolin again is an option. And for management of cholera prophylaxis, oral erythromycin and neomycin is an option. And in case of emergency management of cholera, we have ceftriaxone, cefotitan, and cefazolin and metronidazole. These are the options. Cephalosporin are mostly an option as used in case of recommendation for surgical antimicrobial prophylaxis. Appendectomy, in this situation, it is recommended to use cefotoxim, metronidazole, or cefazolin. And in case of hysterectomy, the option is cefazolin, cefotitan, and cefotoxin. These are the option. In case of cesarean section, cefazolin is option. So majority of majority is including cephalosporin option for the management of recommendation for surgical antimicrobial prophylaxis. So next, I will mention some drug who have CNS penetration, so through cerebrospinal fluid penetration. So these drugs include ampicillin, azathioprine, cefapime, cefotaxime, cefazodime, and ceftriaxone, cefuroxime, ciprofloxacin, imipine, meropenem, Nifacillin, penicillin G, sulfamethoxazole, trimethoprim, and vancomycin. These drugs has CSF, that is known as cerebrospinal fluid penetration. Now I mentioned some drugs that require dose adjustment in case of renal impairment. I will mention some of the commonly most useful drugs that is include acyclovir, amantadine, aminoglycoside, and cephalosporin, erythromycin, and daptomycin, and ethanbutol, famciclovir, fluconazole, and flucytosine, and oseltamivir, and penicillin, and promethazine, pyrimethamine, quinolones, rifampicin, and telebocin, and these are the drugs which include. This is a very complex list, so I will mention all those drugs which are we often use: sulfamethoxazole, valcyclovir, vancomycin, zidovudine. These are the drugs which require dose adjustment in case of renal impairment. Similarly, I mentioned some drug that is absolutely contraindicated in case of renal impairment, that include cidofovir and nalidixic acid, nitrofurantoin, sulfamethoxazole, long acting, and tetracycline. These are the absolutely contraindicated in case of renal impairment. Now I'll mention some drug that require dose adjustment in hepatic impairment cases. It include capsofungi and clindamycin, erythromycin, phosphomycin, and metronidazole, tigacycline. These are the drugs which require dose adjustment in case of hepatic impairment. Now, my last option is I will mention some bactericidal and bacteriostatic antibiotic for the record. First of all, we'll mention the list which are bactericidals, or you can say bactericidal agents: aminoglycoside, beta-lactam antibiotic, daptomycin, phosphomycin, glycopeptides, isoniazide, metronidazole, polymyxin, pyrazinamide, quinolones, rifampicin, and streptograms. These are the antibiotics which actually acts as an bactericidal action, has a bactericidal action. Similarly, I will mention other drugs which have the bacteriostatic actions, or in other words, it is known as the bacteriostatic agents. It include chloramphenicol, clindamycin, ethambutol, macrolides, nitrofurantoin, novobiocin, and novobiocin, oxazodiones, and tetracycline, ticacycline, trimethoprim. So these are the drugs which are considered as bacteriostatic agents. So I just mention it just for the information, because I got a very useful information. I thought that it will be very effective and maybe used for prescribers as well as for exam point of view. So thank you so much for listening, and if you feel that my effort is helpful for you, then please subscribe my channel,